Hi, I'm Lisa Byrne.
And I'm Lori Gambacorta, and we are the founders of E.P.I.C, Empowering People, Inspiring Community, Conscious Living magazine. And today's segment of E.P.I.C Experts, we are happy to welcome Dr. John Rothchild of Holistic Dentistry Durango, and we are so happy you could join us.
Well, thank you for having me, guys.
Yeah, thank you so much, Dr. Rothchild. And we'd love if you could give everybody a description of your business.
Well, I'm a dentist. I'm a general dentist involved in holistic dentistry, biological dentistry, health, and I've been practicing dentistry for 40 years and involved in the health aspect of dentistry for, close to 40 years too. It's, we're looking as a holistic dentist, as a biological dentist, we're not just looking at being gum gardeners and tooth carpenters. We're looking at the whole body, and what we put in your mouth can affect your health, and what we take out of your mouth can affect your health. So we're looking at, it's very important to look at that aspect of medicine and dentistry. This is health, and dentistry is part of health.
So let's get into some of the specifics of what you put in your mouth and what comes out of your mouth, and maybe talk a little bit about mercury and fluoride and what your view on those are.
Okay, sure, be happy to. Well, we know that mercury is a toxic substance. It's one of the most toxic substances known to mankind. It's up there. I think arsenic is just above mercury. Yet, as dentists, we were always taught that we could put that in people's mouths, and we've been placing mercury in people's mouths since the late 1800s. I think it was 1860s or it was 1869 when the first mercury fillings were done. Coincidentally, that's when multiple sclerosis was also came about exactly at the same time in, I believe it was in France. So mercury we know is a toxic substance, yet as my profession puts in a lot of mercury restorations, and I don't feel that we should be putting that in. It causes immune problems, it causes calcium imbalances, it gets into all different organs and locks up the organs so they don't function properly. It gets into the brain. It can cause cognitive issues. It's a pretty toxic substance. Yet we, as our profession, we think it's okay to put that material in people's mouths. I'm one of a number of dentists across the country that feel that no, that it's not good to put that in people's mouths. So I haven't put a mercury filling in since probably about, well, over 36 years ago. So there are some very good materials out on the market now that are biocompatible, biological, and are less harmful or non-harmful to the body, and it doesn't react. So, and that's what we do. We look at what materials we can put in people's mouths that do not react and do not cause reactions. So does that answer?
Absolutely. And how, can you talk a little bit about fluoride as well?
Yes, I would be happy to talk about that. We obviously, if you remember, we had some issues with fluoride a couple of years ago when it came up with the up for a vote here in Durango, and I was one of two dentists that put my profession on the line and said, I don't think we should be putting fluoride in the water. Fluoride is a toxic substance at high levels, and anything at high levels is toxic. I mean, you can drink too much water and die, but fluoride is a pharmaceutical. It's not, and it's the only thing they place in water that is not to purify the water, but it's supposedly to fight tooth decay. But and they keep changing the levels of fluoride in the water because they're finding that the higher levels are toxic. But it's the problem is we know that fluoride is a neurotoxin, and that's in the research. It's all you have to do is look that up. But the problem, and there is research that does indicate that, yeah, maybe fluoride does help prevent cavities, and it's been real sketchy. Maybe some of the research or some of the opinions out there saying, oh, it prevents 93% of all cavities. Well, nothing prevents 93% of all cavities, except maybe brushing, flossing, staying away from sugar, and seeing your dentist. And then most of the research says, oh, maybe it will help 23% of the time. So what they're equating 23% of the time is 23% of your mouth. So that's like one side of one filling per year. So, and the if you read the epidemiological studies, they're not really good. They're biased. Who's doing the epidemiological studies? The companies that are paying for the fluoride, the municipalities, the dental associations, et cetera. So if indeed it does help, fluoride does help, okay, use a fluoride toothpaste or use a fluoride rinse. You don't have to do fluoride toothpaste. You don't have to do fluoride rinse. You don't have to drink the water. You don't have to do fluoride treatments at the dental office. All you need is a little bit. And my gosh, brush your teeth, stay away from sweets, and floss. I mean, that's it. The fact is, we're looking at quantity. So if we've got fluoride in the water, it's kind of the same thing as beer. What is beer? 5%, 6%. So am I drinking a pitcher of beer, or am I drinking a glass of beer? It's the same percentage of alcohol, but it's quantities. So if you're giving a baby fluoridated water, do you think that's going to affect, and that baby is drinking a gallon of it, do you think that's going to be different than if that baby's just drinking a glass of fluoride? Or if you've got a 300-pound or a 200-pound football player who's drinking a gallon of water after practice, is that different than a baby drinking a gallon of water? I mean, come on, there's differences there. So, and it makes sense. I mean, it should not be regulated. It should be our choice whether we want to use fluoride or not. And either you can get fluoridated water from the stores, and if you really want to, or again, use fluoridated toothpaste, or rinse, or go to the dentist and do the trays. It's the fluoride treatments. But you don't have to do all of that. That's overkill. And you don't have to drink fluoridated water. It should be our choice.
Thank you for that and your position on that. And, did you ever think when you got into dentistry that you were going to become part politician, part dentistry, because you have to go through all this red tape and educate people, about the health issues concerned with?
Well, no. And I got into dentistry because I wanted to be in the medical profession. But then I started looking at my profession, and I was looking at my own health and what are we doing really? And I had a mentor that I studied orthodontics with, Dr. Tom Howard out of Iowa. And he was a mercury-free dentist, and I spent weekends at his office, days in his office, and learned about orthodontics, but also learned a tremendous about holistic dentistry. So he became a big, big mentor for me. And it just opened my eyes to a whole bunch of issues of health and dentistry, and it's helped my own health too. So that's why I did it originally. But my God, it's been a lifelong project of mine, is to be able to help people with their health through dentistry.
And as a holistic dentist, can you tell people what they can expect when they come to the office, and what are some of the things that you do differently as a holistic dentist that they can expect if they come to you?
Good question, Lori. Well, when a new patient comes to my office, we go through a whole battery of tests that really any dentist should be doing. We do a thorough examination. We check their jaw, we check their gums, we take photographs of their teeth, we check the charges coming off their metal fillings and metal crowns to see if there's any electrode conductivity that could be affecting the brain. We do salivary pH to see if they have a balanced oral cavity or not, because too high or too low of a pH could cause problems with breakdown in not only the mouth but the body. We do and tooth cavity detection X-rays, but with the cone beam, the three-dimensional, we can look at a whole bunch of different things. We can look into the sinuses. We can see stealth infections. We can see airway, which is a huge thing. We're doing a lot with sleep disorder breathing these days, which is, it's holistic, but it's not. It's what every dentist, the ADA is saying that every dentist should screen for sleep disorder breathing. And we're going very heavily into that. What we do also is we'll check your airway, we'll check the patency of your airway, we'll check your tongue, if there's a tongue tie, which could be causing airway issues. We do a whole battery test. You're in our office for about an hour and a half to 2 hours going through a whole bunch of battery tests. And then we set up a plan according to what the patient really wants. What do they want to get out of it? Do they want health? Do they just want a couple fillings replaced? Are they coming in for pain? If they're coming in for pain, well, then we deal with that one issue specifically. But this is not, what we're doing is not any different than any other dental office is doing, but should be doing. But we do a lot of different things. And then we also look, at if the patient is here for health reasons, we try to look at root causes. Could the root causes be part of the, could dentistry be part of the root causes? And yes, it can. There some of the statements out there saying that 70% of your health can be coming from problems in your mouth.
And
Just to follow up on that, can you give just like a couple specific examples of how something in the mouth can affect other systems of the body?
Hang on a second. I lost you here. Wait. Okay.
Well,
I was trying to turn off my AOL. It's beeping. So, okay. Can you repeat the question, please? I feel like I'm in court here. Let's go ahead.
Yeah, just to follow up on that, I would love if you could give folks just a couple of specific examples of how something in the mouth can affect other systems of the body.
Yeah, well, one of the biggest things that we see is how root canals can affect the body, that infected teeth that never really heal from a root canal can affect the health of the body. Bugs, there's always bugs around root canal teeth, and bugs that swim can swim anywhere. So, and we can pick that up. A lot of times we can pick up infections that you can't see on a normal x-ray, a normal dental x-ray, with the three-dimensional cone beam x-ray. And then we can see that how some of these infections are affecting, say, the sinuses. You can see how directly related a tooth that has a root canal or a tooth that's infected has penetrated into the sinus. So we see that is periodontal disease, can affect the body. They say that one of the big bacterias in periodontal disease, Porphyromonas gingivalis, affects the heart, affects the brain, affects a lot of different systems. Again, bugs that swim can swim anywhere.
can you also elaborate a little bit on people's maybe physical experience when they're there with you? I know, people have anxiety sometimes when they come into offices, and I think you guys have some ways to help alleviate some of that for people.
Yeah, we do. First of all, I try to tell a joke, but that doesn't always go over very well. I try to keep things light. My team tries to keep it light, but Again, some people don't understand my humor, but that's okay. But other way, I mean, I've got a great team of ladies that work with me, and the minute you walk in, people feel real relaxed, and I mean they're greeted well. They my clinical assistants really take care with these patients. So we try to set these people at ease. We try to understand what issues they've had in the past with other dental visits, and quite frankly, a lot of them are from childhood, and we're not going to be able to probably get rid of these anxieties, especially from childhood, but we can do our best. We can comfort them. We have several techniques. We do color therapy in the office, so we have different color glasses depending on what resonates with them. We can do acupuncture, which will help relieve and sedate a patient. I can do some craniosacral work, which will help. We also have the standard dental equipment, nitrous oxide. We can also do oral sedation if someone's really, really apprehensive. And if they're really, really apprehensive, and especially young kids, I'm on staff at Mercy, so I can go to the operating room and work in that arena too. So there's a multitude of different ways we can keep people calm. But I think it's my jokes that do most of it. I will not quit my day gig though.
So can you tell us a little bit, like how do you continue to learn and grow? Like, how do you stay on top of what's new in holistic dentistry, and maybe, for example, how the whole sleep disorder thing came about?
Sure. Well, if you try to catch me on a weekend, I'm probably at least half my weekends are out of town. Either I'm teaching. I teach at a big teaching institute in Phoenix, but that's been kind of shut down right now. For this weekend, I am teaching, but it's going to be over Zoom. Otherwise, I'm out and about at different seminars. I probably do. Right now, this year, I've probably done about maybe 200 hours so far, 250 hours so far of continuing education. Because you have to, with what I'm doing in my practice, not only holistic, but the general practice principles of dentistry, I have to be on top of everything. So because of the COVID issue, everything has been moved to Zoom or webinars. So I've been spending a lot of time on webinars, and that's kind of my passion. I like to learn. So we're keeping up, and my team members are also. So they enjoy the continuing education almost as much as I do.
And since you mentioned COVID, that can be another stressor for people, around coming for a visit to the dentist. Can you let us know if there's extra precautions you're taking? What are the guidelines now that people can feel safe coming to visit and get their oral care taken care of?
Oh, that's a great question, Lisa. Yes, we've taken this COVID issue very seriously, and we've revamped our program. We've upregulated it. Dentistry in itself has always been a very, very safe and sterile environment, and probably most offices ever since the 1990s with the AIDS issues, the bloodborne pathogens, wearing gloves and masks. That's when it really, really started. I remember the days when I started, we didn't wear gloves. I mean, I'm doing oral surgery and I got, blood on my fingertips, and you can wash that off, but now we're all gloved up and masked. Now with the COVID, the issue is airborne aerosols with this type of virus. So we take this very seriously. We deal a lot. We have extra high-speed evacuation systems that are gooseneck that go up right in front of the patient that could suck your tonsils out and probably do liposuction at the same time. It's pretty powerful. We do, we spray down the office, disinfect the office at least twice a day. We have ozone generators throughout the office, cleaning the air. We have a bunch of different integrative machines here trying to keep the air and the office virus free and clean. And of course, washing our hands, gowning up if we have to, everything we can. I mean, we're limiting our waiting room as far as how many people we can get in there. And a lot of people would prefer waiting in the car, and that's fine. We can call them. They just let us know, text us or call us when they're in the sitting outside, and when they're ready, we bring them in and we bring them straight back to an operatory.
It's great. I think that can put people a little bit at ease, that they know if they need to take care of something that they're
absolutely. If you wait too long, it can be, number one, costly, and number two, it can definitely affect your health. So we're doing our best to control that, and I think we're doing a really good job. We've had a lot of compliments from our patients about that.
It's always good when you get that great feedback. You said you've been doing this for 40 years, and your passion, I think, is really coming across, the passion for what you do. So if you could go back in time and offer your younger self some advice, what would it be?
Good question, Lori. I am looking for an associate to bring into the practice to mentor, and I've done that on several occasions. I've had younger dentists come visit me and shadow me throughout my years. I had one young dentist from Argentina, who spent a month with me, and I kind of blew his mind, and he just came back, his eyes were like, big kitty cat eyes, he loved what we had to do. So I am doing that. I mean, I look back and say, okay, this is what I need to do. I need to teach younger dentists who are like-minded the ins and outs of dentistry and holistic dentistry, health issues. We're not getting that in dental school. You're not getting the health issues in dental school, and you're not getting the expertise that you really need for just doing dentistry too. And there's techniques, and you get better at it, as the more cases you do. 40 years, I think I'm reaching my prime now. So, and it's just, it's fun teaching. Like I said, I do teach maybe once every month or every other month, and I like doing that. So going back, that's it. I mean, just teaching what I know to a younger me, or a younger dentist who's interested in what I have to say.
Well, we have a few more questions for you, but one thing you had said earlier about, there's obvious things we can do to keep our oral care is at the highest level, which was, flossing, brushing, don't eating sugar, visit the dentist. But are there particular foods also, like, the apple a day keeps the doctor away? Is there any foods in particular that you would suggest that people are mindful in eating them to help cultivate better care in their mouth?
Well, better care of your mouth is also better care of your body. You want to stay away from, what we recommend is staying away from foods that you have reactions to. A lot of people have reactions to gluten, dairy, corn, those type of things. Sugar. I mean, sugar in any of these foods, if you react to them, are pro-inflammatory. They're going to cause issues in your gut. And if they're going to cause issues in your gut, they can cause issues in your your mouth too. The mouth is the beginning of the gut. So we see that. So the key is to eat healthy, your ancestral diet, stay away from junk food, stay away from the bottom shelves of Walmart, and the groceries, the crap, and don't listen to what you see on TV, especially the kids, snack kids. Stay away for the kids, stay away from sugar, stay away from the sticky fruit roll-ups. Coca-Cola is absolutely terrible. It's acidic. The average patient or average kid drinks, I think it's 24 ounces of soda a day. And that's acidic, and that's not good. I can always tell if someone's doing the Mountain Dew, by the amount of calories they have in between their teeth. So
that's crazy. So, well, and conversely, because we just went through, that's a big list and fantastic. Well, you said eat a healthy diet, but there's no just in particular, right? There's no like eat apples, eat ginger, eat certain things that would really keep your mouth at a good level.
I mean, turmeric, ginger, those are anti-inflammatory. Tea tree oil, you're brushing. We have several natural mouth rinse products that work really well. Actually, one of them I did the original research on, and the company decided to produce a toothpaste and a mouth rinse because of that. Yeah, I mean, just, I always tell my patients, you can kill yourself and make yourself sick by trying to be healthy. So just try to do the best you can, by God, and don't do stupid things. Don't, McDonald's, come on. Yeah, Burger King has a big deal. These 2 Whoppers for $5. Yeah, go for it, sure. Then come see me. I'll tell you what I think. So yeah, just eat smart. There's anti-inflammatory herbs out there. Oregano oil is another one. Coconut oil is good. Some people like to do the oil pulling with either sesame oil, coconut oil, and the research. I did an article on that a few years ago, and the research is really sketchy on that. So what I tell my patients, if it feels good, go ahead and do it. It's not going to hurt you. And because we do have microscopic evaluation, we have microscopes in our office, so we can take a look at the bugs in people's mouths and see if their toothpaste is working, if their oil pulling is working, and look at the health of their bacteria right then and there. And they can see that on the big screen and on the computer screen. So it's very telltale, eye-opening too.
Yeah.
So does that answer? I mean, there's a lot of the nutritionist. I mean, there's a whole bunch. I mean, that's a course in itself as well. But the few things that I mentioned. I mean, I drink an herbal tea with ginger in it. I drink a lot of that during the day. So and I take turmeric also to keep my inflammatory issues down, and I stay away from sugar. No soda.
Good to know, because I had turmeric in my smoothie today, and I also drink a ginger turmeric tea. So that's
okay.
Sounds like I'm doing okay, and I'm brushing my teeth. Yeah,
it's one of the best things. Yeah,
I think it's fantastic, all of the information you've provided thus far, and people can get a sense of they really are having a holistic, healthy experience when they come for a visit. And you're all about their health, not just, hey, let's just fix the cavities in your teeth. You're exploring all of the tools you have at hand to give people the best opportunity to learn and educate themselves about their oral health and how that relates to healthy living in general. So
yes, education is the key. We sit down and we try to make people understand what we can do to help them and what they can do themselves to help themselves.
So now, not that you're ready for retirement anytime soon, but let's jump ahead in the future. You're ready to retire. What do you hope is your biggest contribution to the community and to the world at large?
Well, it's a good question, Lori. I'm doing a lot of thinking on that. I've done a lot in my profession now. I enjoy what I do. I just, you know, if and when I retire, just people come up to me and say, hey, Rothchild, thank you for helping me maintain my health. When I left Chicago, I had a couple patients come up to me the last week and say, hey, John, you saved my life. And that kind of made me feel good. But I didn't save their lives. I just put them in a position that they could maintain themselves and get better health. You know, it's not, I'm not I'm just a facilitator, a mediator. I just do what I can do. And the patient either gets healthy or they don't, you know, or they're on is it the first piece of the puzzle, or is it the last piece of the puzzle, or is it something in between? But it's all, staying healthy is a lifelong proposition. You know, you got to keep working in it.
Well, we've enjoyed so much of this conversation with you. And can you let people know how they can find out more through your website or social media or anything you want to offer for
Sure.
people to look up?
Yeah, I'd be happy to. Well, my website is Holistic Dentistry Durango. The email for the office is information1@holisticdentistrydurango.com. And my number is 970-382-7780. We also have we have our own separate sleepsolutionsdurango.com, which you can look up that website, which we're doing a lot of sleep breathing disorders, treating that with appliance therapy. And that's been a lot of fun too. So that's just a huge part of health. Where people are not getting enough sleep, they're not getting good quality sleep. So look that website up also.
Yeah, and we, you know, when we've looked on there before, we know that you have a lot of information about holistic dentistry and all of the opportunities for people to learn from what you've put out on your site with articles, and you've written some articles for E.P.I.C too, so they can go back and check out everything there. So
yeah, I've got some more in line that we'll need to work on, but yeah, I'm in the process of doing a couple more articles. I like to write. I like to spread the word. You know, I enjoy when you have a passion for this stuff. You work on it. You work on it. You have fun with it, and my team has fun. I mean, I'm in a great profession. Dentistry has been a great profession for me, so I'm real glad where I'm at, and I'm real glad I'm in Durango. This is a great town, absolutely great.
And tell people where the office is.
Pardon me?
Tell people where the office is.
Oh, where's the office? We're in the Three Springs area, just down where near the bank, just past the hospital, a couple blocks, and it's a storefront, and you can't miss it. It says Rothchild DDS on it.
perfect. Thank you so much, Dr. Rothchild, for your time and your wisdom and sharing that with us. And everyone, please visit him at holisticdentistrydurango.com. And for more information about E.P.I.C, it is epicmag.org.
Yeah, thank you. And yeah, please visit me. Lisa, Lori, it was a pleasure. I really enjoyed this. We had some fun, didn't we?
Yes, thank you.
Sure. Thank you.
Okay. Thank you. Bye, everybody.